So this is a loading technique to the back part of the leg. That's that area that goes from right about the knee bend to right where the ankle bends, the back tissues. So what you're going to need is you're going to need a ball or a foam roller or something equivalent. So now there's two different ways that you can do this. You can do it lying face up, or you can do it in a long sitting position. So I'm going to show you in the long sitting position. So you're going to take the foam roller, you're going to place it onto the floor. Now you can do it with both legs on top of the foam roller if you choose. I'm going to actually just do one leg for demonstration. So what I'm going to do is, the first technique that I'm going to do is called the seek and destroy. So what I'm going to do is I'm going to start at my ankle and go towards my knee, roll up towards my knee until I feel a sensitive area. Once I feel a sensitive area, I'm just going to hold that position. Then what I'm going to do with the other leg, I'm going to crisscross applesauce to add a little bit more weight on top of this leg, so I feel an increased sensation into that target tissue that I'm working on, or the sensitive area. And this, just kind of hold that there until it kind of lightens up. Once that lightens up, then I'll uncross and then I'll try to find another tissue and do the exact same thing. I'm going to cross and just add a little pressure until I feel it kind of desensitize. The second alternative that you can use is called the pin and stretch. So what I'm going to do is I'm going to go up towards my knee, trying to feel for that target tissue where I feel an increase of sensitivity. Once I feel that, I'm going to hold that there. And then I'm going to use my ankle, and then I'm just going to move my ankle up and down and just kind of go in different directions, just so I can experience a different load into that tissue where I feel that sensitivity. Once I feel like the sensitivity has kind of decreased, then I can progress to the next area and do the exact same thing. So I feel it right there. So what I'm going to do is I'm going to pin that tissue down, and then I'm just going to stretch it out by moving my ankle. If I want to, I can actually rotate my leg in and out a bit. So a lot of the times people will just go straight up and down, but if you actually swivel your foot outward, you can get a little bit different variation on the back tissue and do the exact same thing. So I can go this way. If I do the pin and stretch, I can pin it that way and just kind of move my foot in different directions, nice, slow, and controlled. I can even work by using my toes and moving my toes and my ankles, trying to see where I feel most of the tension build up underneath that tissue. And then just hold that there. And then again, I can turn my foot the opposite direction. So I'm going to turn it towards my midline or inward towards that opposite foot, and then do the exact same thing. So I feel an increase of load right there. I'm going to do the pin and stretch and just kind of move my foot, move my toes in different variations. Or I can just kind of hold that position and crisscross applesauce and do more of a seek and destroy type of maneuver. So the other position that you can do for the back part of the leg is lying face up, which I'll demonstrate. Now when you're doing this one's a little bit more choppy, because when you lie down, it's really hard to allow the roller to go from the bottom of your ankle up your knee and vice versa, going from your knee down. You're going to have to use the other foot to kind of maneuver around to see where you feel the increase of sensation, just like I am right now. If you want, you can also try moving your body up and down like that, but again, it gets a little choppy and it's a lot of effort doing this way. That's why I prefer the long sit position.